Hi, everyone. We're having so much fun with Dr. Josephine Weber and Dr. Annie Batista from San Francisco Bay Area. We are here live, Dr. Josephine and I, in Las Vegas at the Mobile Dentistry and Teledentistry Conference. And we are going to talk a little bit. They just joined Geriatric Housecall Dentistry. They've been doing mobile dentistry forever, but they just joined our amazing network because people find us. They find us and they click on our website, they see all our videos, so that's what we're doing. We're filming some videos so you can get to know them. We are going to talk about dentures. I don't know if it's your favorite subject. I don't know if it's your favorite subject, but it's definitely mine. So Dr. Annie Batista, let's ask you some questions. I'm gonna fire them at you and I want you to give me your answers. Do you often get people calling you saying that they're sick of the adhesive in their denture and it no longer fits, but they're worried that their loved one might not cooperate for a new denture? They can't follow directions. Do you get that a lot?
Oftentimes.
What do you do?
We make them a new one. They can wear their existing one as a temporary. We fix it. We could do a same-day repair, chair side, and in the meanwhile, we'll start making a new denture.
Okay, but perhaps they are not going to be cooperative to get the thing done. They can't, maybe you could take an impression, but you know, the steps are kind of difficult. Is there any other remedy for a loose denture? What about you?
Yeah.
What do you have to say?
Well, we use the soft liner and have them wear that until it gets used. They get used to it for a day, and then we can either do a chairside reline or we send it to the lab, and you get a sure fit fitting denture after that. Almost a new one, but at least they don't have to adjust to something new.
And sometimes they're 99 years old. They may be hospice, and they can't go through the whole denture process. So how do you explain to the patients if a denture is loose, like what you can do to help them? How do you explain it? Because they're like, how is it going to work? I don't want them to use the adhesive. I don't want to spend the money to do this. What can you do to make it tighter?
We can always use the chair side relines, or what's best is the soft, so that captures all of the landmarks that's necessary for the denture to stay in the mouth.
So a reline, either hard or soft, or a combination of both.
Yes,
That's something that we learned here because the product didn't exist before. So we're able to make a hard reline and a soft reline, so it's comfortable.
Yes.
Yeah. Do you often get the question that the denture is rubbing?
Mm-hmm.
And it never rubbed before?
Yes.
So what do you do?
Make some adjustments. I work with a lathe. It's a big instrument, a laboratory instrument, because prior to becoming a dentist, I worked as a lab tech.
Amazing.
So I have all of these things that cleans up faster and cuts faster, and patients don't have to wait too long.
Do your dentures, people often ask me, so you make a new denture, do you include the visits, the adjustment visits? How does that work?
Yeah, the adjustment visit, as long as they need the adjustments, we'll come back and make those adjustments, because sometimes it takes a little bit for the denture to really fit, and they might get a little sore spot here, so we take that off and then polish it up.
Dr. Batista, do you do denture repairs? What if someone has a cracked denture? Should they crazy glue it until you get there? Did you hear the question, Dr. Batista?
She's frozen.
Are you frozen again? Technology. I have a question for you. So a patient calls and their denture cracked just in half. Do you tell them to crazy glue it until you get there?
No, we'll be there.
God forbid! That was a trick question, everyone. We're just being funny. Go ahead, Dr. Batista.
No, don't crazy glue anything.
Ever.
I will be there right away.
Is it easy or hard? It's easy to fix a cracked denture in half. Never touch it with yourself. Don't do any of that stuff in the CVS or Walgreens. Never repair it yourself, right?
Yes, because it needs to be precise, and the lab can only do that precisely.
Exactly. Never touch our stuff. How about clasps? Do you often hear that a clasp might have broken off?
Yeah, if it's a broken clasp, I can always ask my lab guy to add a clasp on there so that the denture holds nicely in the mouth.
And just so all of you know, there's many types of dentures. and many types of partial dentures. And when we evaluate you, we will tell you what's best for for your mouth and for your mouth condition. So if you have any denture needs, whether it's repair, a reline, just an evaluation, give us a call. Not me, them. Go on the website, fill out the form, put as much information in the message box as possible. My mother's 85 years old. She is not a candidate for a new denture, or she is a candidate for the new dentures. How much do you charge? What is involved? We are here to answer your questions. We get back to you right away. Yes. So out for now. Bye, Dr. Batista.